Hello, my name is Sabrina Baird Gerber, and I am applying for the position of Director of Community Services. My mission for the position is to provide the people in our area with the information they need on the health issues they have when and where they need it. I envision health and wellness information being provided throughout the health system in ways that it is easily accessible. My educational qualifications include a Bachelor of Arts degree in anthropology and soon a baccalaureate degree in nursing, both from the University of Tennessee. I graduated from nursing school in 1994, but getting my BSN will help me strengthen both my clinical and my management skills, as professional registered nurses are trained to be leaders in our field. Getting and keeping people in the community informed should be of utmost importance to everyone in the healthcare community. I see that as the most important aspect of this position. I believe my leadership skills, background and cultural relation skills as an anthropologist, and vision for the future of the position render me the perfect candidate for the position of Director of Community Services. My leadership style in this position would be a perfect fit. For this position, I would incorporate goal-oriented focus into my belief that a leader should be strong, but willing to listen to all concerns and have an open-door policy. As this is a newly created position, I am open to input from the volunteers and staff who will be working alongside me in community health and wellness events. I also believe that careful budgeting of expenses is critical. It would be easy to overspend on a large project such as the one I am going to propose, but I believe with the proper management skills of critical accounting it can be done. By the end of this year, I would like to install information kiosks in the main lobbies of each hospital in our health system. These kiosks could have electronic touchscreens with thousands of options for patients to choose from that include health and wellness information, disease information, nutrition information, and healthy recipes and symptom checklists to bring to their doctors if they suspect an illness. These would all be printable for the patient's use. My overall objective is knowledge is power. A more knowledgeable public could be a more healthy public, but we need to get the knowledge into their hands. In the first 6 months after the kiosks are installed, there will be an optional survey that comes up on the screen after the users view their information, asking them to rate their experience. We'll then use this information to determine the expansion of the program. Shopping malls and other public areas would be the next step. The objectives here would be ease of access and ease of use. Since they would be sponsored by the health system, the users who need us hopefully would soon become our clients. Live health and wellness events are another of my goals. As you know, the Healthy Living Expo was last weekend at the Convention Center. We could do several health checks at these and other events, such as blood glucose testing and diabetes teaching, and bone density testing and osteoporosis teaching. And during Stroke Awareness Month, such in May, we could do blood pressure checks and provide information regarding risk factors, signs, and symptoms. The benefits to the public are obvious, and the health system furthers its reputation as a top-notch wellness facility. I propose that all these services be offered at no charge to employees. A healthy staff has higher productivity and less absenteeism. I would be responsible for coordinating all health and wellness events both within the health system and in the community, and the recruiting and scheduling of the volunteers who work them. And I would be the liaison to any community groups we should work alongside. I would arrange to work with local associations such as Susan G. Komen for the Cure and American Cancer Society, as well as groups closer to home like the Alzheimer's Association. They organize the annual Memory Walk here in Knoxville. Another very important goal I have is getting the word out regarding places where women in abusive relationships can go for help. I propose that at every health and wellness event, a section of educational material regarding domestic violence is available. Off to the side, no fanfare. Phone numbers and websites will be listed for her to use if she chooses to do so. This would be a very serious aspect of the position, but it is a serious public health issue. Not only are women in danger, but children as well. I love the teaching aspect of my job as a registered nurse. The educational skills I have learned have become invaluable in my career as a nurse in community health. In the community health sector, I volunteer with Remote Area Medical Service, a free medical service to individuals who cannot afford medical, dental, and vision care. Part of our responsibility there is to teach healthy lifestyle habits to patients who come into the clinics, but the truth is, no one can ever know too much about how to take care of ourselves. This is where my passion for community health nursing began. I know I can put that passion to use as the Director of Community Services at this health system. The possibilities are endless when it comes to community education. I am the person who can lead you to these possibilities.